Zealand, Brazil, America, not to mention I'm sure there's other places as well. So I just wanted to say a huge thank you for coming along, but also for being really open. We had some amazing talks yesterday, and I'm incredibly grateful that you are all so keen to try and make the world better, basically, and to try and help people with care, compassion, kindness, passion to make women's lives better, but to also make everybody's lives better, and to be open as human beings, really, which I think is a wonderful thing in this time. I think all of us get a little bit overwhelmed, which is why we're also talking as well about mental health, as well as the issues that women face in the world. So I'm here in my capacity to talk about massage, mental health and sedentary lifestyle. So my name is Sian, not Sian, or Sean, and I've been a clinical massage therapist and specialist now for 11 years. And when COVID happened, it was a very difficult time if you were a direct contact worker, which I was. So I decided to upskill, and I joined an amazing community of people at the Jing Institute in Brighton. You would have seen my colleagues Casey and Lucia yesterday presenting about, Casey was presenting about helping with anxiety, stress, depression amongst carers, and Lucia was presenting about asthma and anxiety. And the way that the Jing Institute works, it's very collaborative, it's very supportive. As a clinical therapist or as a massage therapist, you tend to work on your own, and they are brilliant at helping us to work together better, support each other, which is partly why we're here together as a little group. But they're very much about working with the biopsychosocial model. So working not only with biology, but also with psychology, with the emotional side of things and social networks. And in doing that, Jing aims to treat the whole person. You know, they're very much about helping people with all aspects of mental and physical health, because people don't just come with a condition or with either a mental problem or a physical problem. Often it's all interconnected. So we treat pretty much anything, and we look at all kind of issues, from mental health issues to physical health issues to acute and chronic pain. And all of us did a BTEC level 6 clinical massage degree, and this involved us doing a research study as part of that, and a dissertation, and that's what we're here to present today. So I will see if this works. That didn't. There we go. Other way. This is just a quick bio of what I did in my life. I started off at Neil's Yard Remedies. I qualified as a professional aromatherapist and a holistic massage therapist, which meant I could help people with care and compassion, but it also meant that I wasn't necessarily trained to the degree to which I wished to be. I still worked at osteopathy and physiotherapy clinics, I worked privately, but joining Jing and studying for 3 years doing a clinical massage degree really elevated my practice and made a big difference to how I could work with people and what I could offer. As a result of that, I also do teacher assisting, I do mentoring with the next cohort of students, some of whom might be watching me today, and also course supporting with the future cohorts of students, because we need to sort of pass our knowledge on and what we can do as other new generations become aware. And I think that ties in probably with what we were saying yesterday about teaching younger generations as well. We need to pass on what we've kind of learned, and to a certain extent I think people need to feel that through their own experiences and through lived experiences, but we can also help to pass our knowledge on. Just recently I've also started working for the NHS, which is the National Health Service in the UK. I've been working at St Charles Hospital in Ladbroke Grove in London, and that's quite challenging. So the where I said treating clients affected here, that was just that week. So I was working with Grenfell Tower fire survivors, if you've heard of that. It was a huge fire in a tower block in London where I think it was something like 72 people died. So I was working with survivors from that, but also with complex post-traumatic stress disorder, clients affected by murder, working with refugees. I was working with a client who was sex trafficked and sold into slavery, and had been beaten by her owner. Also clients affected by things like polio, drug, alcohol addiction. That was that one day. So, you know, there's a lot to take on board, but you know, if you work as best we can and with loving kindness, it's amazing what we can do. Working with our head, our hands and our heart, as I've just been reminded. So, why did I look at mental health for my study? Because I could have done all sorts of things. Well, we've all seen the kind of figures. These are some of them. I wanted to work in mental health, I think because during COVID, a lot of people suddenly couldn't run away from their mental health issues. I think a lot of people suppress things by being busy with parenting, being busy with their job. Suddenly we were all at home and we had to actually deal with the things that were coming up for us. And so there was a big rise in mental health issues. Not least as well because we were all facing a pandemic, which was obviously quite scary. And people were dying. And so people had fear and suffering from that. So the figures I've given here are World Health Organization figures. However, what I would say is that to my personal opinion, I think all of us at some point will suffer with a mental health issue. I don't think it's 1 in 4. I think everybody in their life at some point will suffer from a physical health issue. There's something eventually you will die of, even if it's old age. And I think as a result of that as well, there will also at some point be an emotional or mental health issue. It might only be minor, it might not be too problematic, but I think actually to quote 1 in 4 or whatever, it might be that that's the number that's suffering at the time, but I think everybody is affected by mental, emotional and physical issues at some point. So it struck me as a very straightforward thing to work with. Why did I look at sedentary and desk-based lifestyles? Well, we've got a quote here from Mental Health Statistics for England that poor mental and physical health often go hand in hand, which is generally true. And I think Barb's just spoken about the fact that often physical things are linked to mental and emotional things, and vice versa. As someone who's been through the perimenopause and going through it, I was also surprised by how much my mental and emotional state could be affected by a lack of hormones, and how much it was helped by, for example, in my case, going on to HRT. So they're both interconnected. But I wanted to look at sedentary and desk-based lifestyles, partly because during the pandemic, a lot of people were forced to be more sedentary, potentially. A lot of people ended up with home life work, which wasn't always ideal. And that kind of home working often bled into other people's lifestyles as well. You know, instead of going home at 5 o'clock, suddenly they were working until maybe 7. And one of the things I've written about here is that, you know, 52% worked longer hours post-COVID. 40% of people were working during their holidays. Now, when I worked in an office, I didn't work during my holidays. 25% of people were working plus 10 hours longer. And the NHS, I was kind of looking for kind of information about how sedentary lifestyle wasn't very good for you, which I kind of knew. I knew if we stood up, and if any of you want to stand up now, you will automatically lower your blood pressure by doing so. But there was an NHS leaflet, and it said studies have linked being inactive with being overweight and obese, type 2 diabetes, some types of cancer, and early death, all cause mortality. And I was like, oh, and here we are, in a modern lifestyle, mostly just sitting down. Humans have not evolved just to sit. Humans have evolved to move around, to walk, to exercise. We weren't meant to just, as we are doing now, sit in a little box and not see the sunshine and not move. So I wanted to work with people with desk-based lifestyles. Originally I was going to work with office workers, and then I decided to work with people who were also sedentary. So, a little bit more about the issues. Again, depression, anxiety and stress were the specific things that I decided to work with. That was partly because I needed to use a questionnaire to actually assess people's mental health. So I chose to use the DASS, which Casey mentioned yesterday, which stands for Depression, Anxiety and Stress Scale. It's a self-report. So as Benjamin mentioned yesterday, you know, that does have issues potentially, because people are just having to assess their own levels of mental health stress, but it is a recognised medical instrument that's used in research. So I was looking specifically at 3 different areas of mental health: depression, anxiety and stress. And again, the figures are kind of up there. 79% of UK adults feeling stressed at least one day a week. So, you know, it's a fairly common thing, I think, and as lifestyles get busier and more overwhelming for people, I think just because, you know, I remember growing up in the 80s, we didn't have emails, we didn't have constant WhatsApp messages to answer. Sometimes we were just bored, and that was actually quite nice. We probably did a lot of unintentional meditation, I think, and unintentional mindfulness that we don't really get a chance for now. So, just to carry on a little bit with the figures, you know, it's great to quote statistics in these things, but I was looking at the fact that diagnosable mental health problems are the largest single cause of disability in the UK, and healthcare costs and prescriptions of antidepressants rising 35%. Now, it's not that I don't think we shouldn't use antidepressants if required, and maybe as a short-term thing to help us, but, and for some people they are very necessary depending on the circumstances, but, you know, is there something else we can also look at? There's got to be other ways we can help each other through different therapies. And so that's what I was looking at with my study. Go. So what was I doing? We all had a similar format, which was that we did an eligibility questionnaire to check if people were stressed enough, basically, if they qualified. We then had a control period, a 6-week control period, where people just carried on with their normal lives and they filled out the questionnaire, and I took a baseline for roughly how they were. And the DASS is quite good also at just pointing out some people were more depressed, some people you could clearly see they were more stressed. Some people, they had high levels for everything. We then had a 6-week treatment period, and then there was 4 weeks where post-treatment we did nothing, but then we assessed them at week 16 just to see were there longer term effects from what we've done. For our brain, our hearts, everywhere else. Something called trigger point therapy, so that's where if you come across those knots in the muscles, tight contractions in the muscles, you can release them. And a lot of grounding. I know that I'm talking a lot now and I'm talking quite fast, but in the treatment it was very calming. I also gave them a self-care routine, just something simple they could do for 5 minutes a day, involving breath work, mindfulness, self-massage and stretching. I changed this up every fortnight just so that people could pick and choose what they wanted to take from it, and it was just something they could do for themselves to help themselves, but also that they could still carry on using after the study, which quite a few of them still do. These are the results, which I love. They were better than I was expecting. I was of course hopeful. However, levels of anxiety fell by 85%, depression by 77%, stress, which I thought might fall the highest, actually was 66%, which is still incredible, but actually was probably the hardest one to tackle, and overall it was 74%. So, you know, a lot of the issues that we were looking at went down. However, the slide I particularly like, which I think is the next one, is about the severity labels. So the DASS you score, which is why I could do the percentages, but they also had severity labels or categories: normal, mild, moderate, severe, extremely severe. That's just me saying the same thing. These are the ones I love, my pie charts. Because as you can see, the top one is depression, the second one is anxiety, the third one is stress. So overall, 56% of my participants were diagnosed with mild or above depression. That went down to 11%. And it's an anecdotal thing, but actually one of those people had just found out that her mother was terminally ill and the other person had multiple sclerosis and had gone from being extremely severe depression, both of them, to moderate. So although they were still people registering with depression, I was like, actually, we still had a bit of a result there. But anxiety and stress, I mean, look at stress, 83% down to 0. We've just got big green cheeses here of normality. I was amazed, frankly, that it had worked as well as it had. So yeah, and I had some amazing feedback from people, I definitely think it helped me to de-stress once a week, which made a huge impact on coping with my job. Your compassion, listening, and magic hands, clients like talking about them, was one of my favourite times of the week. I'm impressed by how much an hour a week can benefit you on such a positive level. So, the study has changed me. My tolerance levels towards people who I perhaps see as not having the same work ethic are higher. Improvement in sleep is wonderful, which we'll talk about in a minute. But one of my clients said, perhaps it is something the medic should recommend rather than simply the Valium range of products, which isn't to say that you can't use medication, but there are other things we can help with. So, in terms of the discussion, why did it work so well? Well, I think because we're looking at treating an individual person. Every client I see, I treat as an individual, because just like you guys, they all are. They're other fellow human beings. They're really amazing people. And Jing and myself are very into the therapeutic alliance. So I really help support and care for my clients. I took the time. I listened to them. And one of our teachers actually did a similar study where all she did was she gave people the same treatment, but she actually gave some people the treatment with therapeutic alliance and some people just a standard cold treatment. And the difference in people's response was amazing. We're humans. We want the power of touch. We want the power of being listened to and the power of being cared for and supported. So I think that was the main reason. But also we had cumulative treatments, a multimodal approach. I was also using acupressure, I was using grounding, I was using lots of different treatment types. Self-care. There were obviously limitations. I'm just one therapist. It was quite tricky treating 22 people a week and then seeing some of my regular clients as well. Life happens. One of my clients got COVID, ended up in hospital for a day. Someone else had to have childcare issues. So, there was a little bit of a problem sometimes with having to reschedule treatments. I would have liked a broader cohort of participants. I was representing different races and ethnicities, different age groups, but there were also a lot of white women aged about 40 to 60. I didn't have as many men as I wanted either, so I think looking at a different range of people would be good, although I did have a big socioeconomic range. There were some issues around timing. I did wonder if it made a difference when the holidays were in terms of childcare, but also the time of year. A lot of people struggle with seasonal affective disorder in the darker months, especially where we are in the UK. I wonder as well about anticipation. It was interesting that when I did the eligibility questionnaire, the results were higher. There was an immediate dip in week 1. And I don't know if that was partly because people were like, oh, I want to be eligible for the study and maybe scored themselves higher, or because the study itself was making people think about, oh, how stressed am I? But also a lot of people said, as soon as I knew I was coming on this, it made me feel better because I knew I was doing something for myself. And I knew I was taking, if nothing else, at least an hour for myself. And as previously mentioned, the DASS as a self-report has some issues, but also it wasn't necessarily, some people found it easy to use, some people less so. So there are very different reasons around why it does work, problems with it. Future research. This wasn't something that I was thinking about when I did the study, but 55% of participants started or restarted some form of exercise. It was a little bit of an encouragement for me to get moving, but I think it made people aware of sedentary lifestyles, but also they just felt better. And so they actually wanted to do something for themselves and they wanted to go out for a walk. Sleep quality was also really improved, and I just started getting feedback from this, so I started taking numbers. Interestingly, 2 people were worse generally on their sleep at the time, but both of them was because they had small children who weren't sleeping well. Everyone else was pretty much either, better or just overall just much more improvement in sleep. As a clinical massage therapist, we know this. People often report better sleep after they've had a treatment. They've switched on their parasympathetic nervous system. They've calmed down. Often what I'm giving people in a treatment is the space to actually just be and that's quite powerful, to actually allow people to put their phone down, go into a room, just be. And also, I think when we lie in bed at night and it's dark, we start worrying about things, we're aware of our pain. When you've got someone actually providing you with the power of touch, people just say they drift off. They always call it like guided meditation. So it doesn't surprise me that sleep has improved, and that's definitely something that someone else in a future study could look at. However, what I was not expecting was the benefits to myself. I actually assumed I would be a lot more stressed. I'm treating 22 people a week. A lot of them are strangers. I'm like, oh, how am I going to do this? You know, it's a lot of people to treat, and some of my regular clients. Oh my goodness, I was treating them with the chronic stress and pain protocols. So there were no client expectations. All the clients were coming in for the same thing. I didn't have to do any paperwork because it was all being reported through the DASS. And I was just doing the same thing, which I thought, oh, I'll get bored. No, it was so relaxing. Obviously not as relaxing as if I'd have been on the couch having the treatment myself, but it was really great. And I noticed I was relaxed more. I noticed I slept better. It's only anecdotal evidence, but you know, I remember on week 2, my partner coming home and he couldn't find me, and it was because I was in the loft doing the filing that I'd been putting off for the last year. But suddenly I had the energy to do, even though I treated 5 people that day. So, you know, I think it would be a really good study for someone to actually look at, you know, do the therapists also benefit? Because this is also our time to kind of focus and also have awareness that we're helping people, which for a lot of people is a lovely thing to do, and it's why we do it. So, the conclusions of the study is that the Jing multimodal and clinical massage approach is suggested to be effective in treating mental health disorders within 6 weeks, which is amazing. I actually added this slide in yesterday because I was thinking about it, about the upward spiral, my way of actually treating people. So I think one of the things I've learned from my own life journey, and I had to do a lot of end-of-life cancer care for my immediate family down the years, so I learned that quite early on in life, that death and suffering happens and it's part of life, but also I had my own experience of having depression as a result of that, panic attacks, anxiety. But one thing I learned was that you always have the ability to change at any point, and that's what I was teaching my clients. And you always have the ability to change how you feel about something. Situations happen. You know, I could have been very nervous about coming up here and talking to you today, although I'm not, because you're all lovely. But you always have the ability to change what you feel about something and how you feel about something. So it might still make you angry, but you have the ability to decide, well, am I going to channel that into something for good? Do I need to make myself stressed with that? You always have the ability to change what and how you feel about any one thing, and that's how I work with my clients. A lot of people talk about us kind of therapy as therapists and specialists. You know, I get people asking me, oh, didn't you take on your client's stress? Didn't you take on their things? You can't help people if you do that. You have to recognize that their stuff is their stuff and only they can help themselves. You can support them and help them and encourage them and get them to do habitual little habits that can be helpful. But you can only work on your own stuff and how you feel about things. And if you're doing them a disservice if you do just sort of sit there and say, oh, well, you know, and take on all their stuff. That's your choice. You can choose not to do that and help them better as a result, I personally feel. It's just my own personal experience, but I think it is true to say that we can only work on our own issues. But we can definitely, by doing that, help people work with theirs. So by doing that, and I've said here, lead by example, learn from others always, so thank you for all the learning I've had from you. But also to be open and inspire people. So I think the reason my study worked so well is because I just helped people I listened to them and I tried to get them to help themselves. And helping people to make changes that lead to other changes, a small drop. So I'm just going to kind of finish off with a little example from one of the people who's on my study. She was overweight, her son was also overweight, some members of her family were. She was working really long, hard hours in a full-time job. She was looking after her daughter and her grandson, who was ADHD, hyperactive, was getting a diagnosis of autism spectrum. She was also caring for her 92-year-old mother who had dementia and had just been diagnosed with issues from that probably meant that she was on end of life care. She was very stressed. She was overweight, she had high blood pressure, she was pre-diabetic, she'd had a heart attack a few years earlier. And she said to me towards the end of the study, she said, "Oh, I really don't want this to end. What can I do? Can you recommend anything? Because I really love the self-care." And she said, "But I'm so busy, I don't have time to do anything." And I said, "Okay, do you think you could maybe, what do you do?" And she explained she had long working hours, she ate lunch at her desk. I said, "Can you get outside and just go for a walk for 10 minutes at lunchtime? You need to see the horizon. This helps our central nervous systems to basically calm down." I was like, "But also, you'll get a walk. It'll improve your mental health, you'll move, it will help lower your blood pressure. If that's all you can do, just try and go for a 10-minute walk at lunchtime." And she kept in touch and I carried on seeing her. And after 6 months, she'd got so into, she loved her 10-minute walks at lunchtime. She loved nature. She got to go out to the park locally. So she started doing more walking. She started walking after work. She just made time for it. She realised that if she did that, she was coping better with her caring responsibilities. So she then decided to start taking her son out with her. They started going off to a local safari park at the weekends with the grandchild and her son and her daughter. And basically the upshot was that after 6 months, she was walking 5 miles a day, every day. I mean, I did actually have to say to her, you know, you can also take a day off if you want. She'd lost a stone, her son had lost 2 stone. She was no longer pre-diabetic, she'd reverted, gone into remission. Her blood pressure had gone down. She was feeling a lot better. Because she'd lost weight, she was then kind of encouraged to well, I want to keep this up. So she started eating healthier. She started looking at her nutrition, which I'd also given her a little few hints about. And she said, "My family are a lot happier. I now care for my mother better, and my mother can tell I'm happier because, you know, I've done all these." So this is how you can get that downward spiral going to an upward spiral. You just have to find the thing that works for the person and just help them to just think outside the box a bit about what they can do and the knock-on effect. And that's why I think it's so wonderful what everybody here is doing. Because if you can make just one little knock-on effect for one person, you do not know what that will do. You do not know if that one thing that inspired that person will then teach that person to become a lawyer in Brazil who starts looking after women's rights and caring, and what you're doing as a Brazilian lawyer looking after women might then help so many other people. So, thank you. We're not quite finished yet. I will bring my stuff back up in a minute, but just before I finish, I have a little game. Well, not a game, it's the kind of thing that hopefully you'll all recognise. So I, once I graduated, was asked to speak to students. Oh, I've got it here, Casey, it's fine. I was asked to speak to students and I wanted to tell them about my research, and you've got slides and stuff. But I thought a really good way to talk to people about my research would be to make little fortune tellers. Now the only thing is I can't hold the fortune teller and the microphone, but this is how to make a fortune teller. I have got some of them made. You might have heard of them as chatterboxes, I don't know. My able assistant here might come and hold the microphone while I get them. Thank you, lovely. So, up I pop. So